colleagues, ladies and gentlemen, thank you for your patience with us till the end of this conference. And I want to take this opportunity to thank Professor Dalia Mohamed for giving me this opportunity, as well as I wanted to welcome Professor Kinesiotaping, our Dean of Faculty of Physical Therapy, Cairo University, of course, with all my colleagues. I will not take further time, and I will start my presentation, which is entitled as Kinesiotaping in Upper Limb Rehabilitation, Post-Mastectomy, Postmenopausal Women, Evidence-Based Practice. And I'll start from the last part of the title, which is a breast cancer. And you know that we just finished the October month, which is the annual month of breast cancer awareness. And I want to give you a hint about the incidence of breast cancer in Egypt, which is presented as a 32% incidence rate, which was reported at 2014. Unfortunately, the rate is increased when there is a report developed by the World Health Organization in 2018, and the percentage was increased up to 35%. And this was expected, as the report of 2014 was expecting or estimating that the percentage will increase twice or threefold in 2050 in comparison to 2030. So it's not optimistic at all. But if we wanted to have a look over the age, what is the age that is highly risky to develop breast cancer? Actually, there is a linear correlation between the age and the incidence rate. As increasing in the age, increasing the rate of breast cancer, and reaching its peak about the age of 50 years old, and its maximum reaching about 55 to 59 years old, which is around the time of menopause. That's why this is the title of my presentation. Then increasing the incidence and reaching a plateau at the age of 70 to 74 years old. So maybe it comes to our mind that the menopause is a culprit in this situation. Actually, the menopause as an incidence itself, it doesn't match the cause of breast cancer, but exposing the female's body to estrogen for a longer time is the main risk factor of developing breast cancer. So developing a menopause after the age of 55 years old, or developing a menarche or the first menstrual cycle in the female's life before the age of 12, this is a high risk people to develop breast cancer. Then, after menopause, the body is being overexpression to the estrogen receptors, which is the main cause or the main underlying process of developing breast cancer. So, in the bottom line, the treatment or the surgical treatment of the breast cancer maybe is ranging between breast-conserving surgery, it's according to the stage of the disease, or going to the mastectomy, which is the surgical removal of the breast, and it's varying from only total mastectomy or reaching to radical and modified radical mastectomy. So by the end, mastectomy is a surgical procedure, so it has some of the post-operative complications which may vary to pain. This pain may be incisional pain, shoulder pain, phantom breast pain, as well as infection, the incisional infection, limited range of motion, excuse me, the sound, thank you. Tissue scars, muscle weakness, nerve damage, and lymphedema. As well as there are additional complications, post-operative complications, like engaging in the normal daily activities. It will be a burden or obstacle in the female's life, as well as lowered self-esteem, distorted self-image, unhappiness, frustration. So by the end, there will be deterioration in both physical and psychological quality of the female's life. So this was a hint about the mastectomy and breast cancer situation. The other part of my topic was about kinesiotaping. So kinesiotaping is some sort of elastic taping. It was founded by Dr. Kinesiotaping, and by the way, kinesiotaping is not named after Kinesiotaping. There is similarity in the pronunciation, but different typing. He's a Japanese chiropractor, and he was practicing his profession, and he wanted to maintain the effect that he was achieving in the session itself. So that's why he started to think about some sort of modality to maintain this effect, and he was, or invented the Kinesiotaping. It's widely used in Asia for a long time, because that's why he's Japanese, and it was transferred to USA and other parts of the world. Nowadays, you can see many dozens of products which is similar to Kinesiotaping, but actually the bottom line, this is the best, the Kinesiotaping from the quality point of view. It's 100% cotton, it's breathable, it allows ventilation, it's water resistance, so the patients can do the daily activity, washing the parts or taking a shower without any complications, as well as it has longitudinal stretch up to 30 to 40%. It relies on different basic mechanisms, the Kinesiotaping effect, like physical correction, facial relaxation, space recuperation, ligament support, as well as movement rectification and lymph fluid circulation adjustment. So if we have a look over this illustration about the mechanism of Kinesiotaping, you can see here the difference between the right side illustration and the left one. This is before the application of the Kinesiotaping. In situation of injury, there will be compression over all the structure underlying the skin, as well as inflammation and congestion processes undergoing. While after application of the Kinesiotaping with the incidence of confusion or recoiling and stretching of the skin, there will be lifting up of the skin and underlying structure like fascia, blood vessels, nociceptors, as well as the inflamed muscles. That's why we gain this effect after application of Kinesiotaping. This is the same one with different publications to validate that the same concept is continuous in different publications. Additionally, for the correlation between the Kinesiotaping and decreasing of the pain, as I mentioned, the convolutions or the stretching and recoiling of the skin is causing relief or decompression about the nociceptors, as well as a stimulation of low threshold mechanoreceptors, which is located in the fascia, in the skin, in Golgi tendon organ, and as well as in the muscle spindles. All of these mechanoreceptors will send impulses to the higher centers of the brain, and at the same time will interrupt the nociceptive impulses, and it acts like a gate control mechanism that we are familiar with when we are talking about it. It's the same effect, so by the end it will decrease the pain. So till here, I already give you a hint about the incidence and the complications of the mastectomy treatment of breast cancer, as well as the modalities that we will handle in our presentation. From now, I'll start to talk about the complications that may result after the mastectomy procedure. As I mentioned in the earlier illustration, I cannot handle today, but I'll talk about only two problems, the lymphedema and the shoulder pain and limited range of motion. If you are familiar with lymphedema, is abnormal accumulation of the interstitial fluid in the interstitial space. Of course, this fluid is a protein-rich fluid, which is a very rich media for developing of infection, chronic inflammation, deposition of collagen, and ended with chronic fibrosis. Lymphedema itself, if you can see it here, the difference between the size of the two lumps, it has a good point and bad point. The good point that it takes long time to be developed. That's why maybe after the mastectomy procedure, we can expect this lymphedema to appear up to 2 years after the procedure or the diagnosis. Because it acts or it works by only 10% of its maximum capacity, which is gives us a reservoir. But the bad thing about lymphedema, unfortunately, once it's developed, it's a chronic fibrosis and no recovery for it. So it's some sort of maintenance treatment and no recovery of it. And worldwide, it's poorly understood case. The incidence rate of lymphedema after total mastectomy, the first procedure of mastectomy surgery, it may be up to 49–50% may happen. So what is the management of lymphedema from the physiotherapy point of view? Actually, the golden therapy rule, it's only summarized in the complex decongestive therapy, which is composed of manual lymph drainage, compression physiotherapy, exercise, and skin care. We want, by the evidence base, to take the kinesiotaping and put it as one of the compression physiotherapy, which is traditionally composed of the intermittent compression therapy, the multi-layer bandage, and the pressure guard. And I wanted to add another point here, that many successful procedures or trials was applied regarding application of low-level laser therapy, and it was approved to be successful modality to be added for this treatment. So let's talk about the application of kinesiotaping in the cases of lymphedema, and it was recommended by Dr. Kinesiotaping, the founder. You can see it here. It's a fan-shaped, we can call it fan-shaped application. We started from the proximal and we are going to distal. So the united part, or we can call it anchor, it's applied around the shoulder from the three sides, around the forearm from the three sides, and we cut it into fan shape, maybe into 4 to 5 straps. This is the maximum, don't cut it more than this, till the level of the hand. Here I wanted to highlight about the application over the chest and over the trunk. Okay? It doesn't work. Sorry. Let's resume. So the two applications over the chest and over the anterior part of the trunk, it's targeting the patent or the normal lymph nodes on the contralateral aspects of the axillary lymph nodes and the inguinal lymph nodes. It's relying on the concept of the lymphatic watersheds. And here is a representation of glory of God, alhamdulillah. And God gives us plan B. Because normally we have like sheds. عارفين اللي هو البحر والنهر لما يلتقوا مع بعض لكن they don't max. This is the same situation. Every quadrant of the body is responsible from the respective lymph node. But in the way of injury, there will be maxing to overcome this obstruction. That's why there is the application over the axillary lymph node and the inguinal lymph node. I wanted to say that the tension of the application in kinesiotaping is ranging between 15 to 25%. This is according to the recommendation of Dr. Kinesiotaping. And please stick to this one because this is my message today. There are many trials were applied with different pressures. That's why we didn't ended up with good results or supporting to the concept. This is according to the available literature, the same concept you can see here as well. This is a spiral application, and here they are applying own method, not Dr. Kinesiotaping method, and it was ended up with a good or significant effect, which is very good according to the direction of the lymph fluid, which is a spiral direction. According to the time limitation, I cannot comment on these two, but only here for the technical point of view. If you have a look over this one, and by the end, the result of this case study was not supporting the kinesiotaping application, and the main cause of this one, if you can figure it out, about the application of the over the back, because they applied with the tail directed to the affected part, not to the sounded part, because the tail is acting like the vacuum, which is suctioning the extra fluid which is accumulated in the interstitial source. This is pros and cons between the two groups of literature. The one is supporting the application of kinesiotaping, and the other one which is against the kinesiotaping. Here the positive was clinical trial, the mice clinical trial. The opposite one, or the against the application, it's mainly towards the systematic review, if you are familiar with systematic review. And this is raising a concern, by the way, and giving us responsibility in the people who are working in the research and the academic part, that we are responsible for developing high quality methodological studies. That's why we need to develop such studies to validate the application and increase the generalization or the external validity of our results.
Thanks, Dr. Dalia. Thanks.
I'll give you the take-home message, please. Give me my opportunity. I was patient till the last.
Okay.
This is the application of the other problem, which is shoulder problem, shoulder pain, and limited range of motion, as well as the same conclusion that we need further studies to be applied. I'm proud that I already participated in this one with research which was published in 2016, and it was cited in a systematic review in 2020, which was started from collecting 520 researches and ended up with 12 high-quality researches. Ours was one of them. I'm proud to say this, but they ended up with that it's supporting the application of kinesiotaping, but we need another and further research. The take-home message, that clinically it's widely used, kinesiotaping, but my request for you as a clinician to go for a trusted source that gives you the correct instruction, the good application, the correct tension, which is very important in the application of kinesiotaping. For the academic people, please, I'm raising the call here for collaborative research and form like a working group to develop high quality researches and validate our results. Only one advice more, that when you apply the kinesiotaping to overcome the skin allergy, make like a sensitivity skin test first. Be sure that this patient is not sensitive to the application, and once the patient is complaining from any itching or irritation, advise the patient to remove it immediately. It's not working for this patient. This is my message today.
Thanks.
Thank you so much.